I'm so sorry, guys. Let's start now. Okay. So, guys, we have this wonderful webinar again in the series of nutrition and dietary, right? So today we have the webinar on food allergy. That many people, have sometimes I have the uh, you know like I also get some allergies from the food, you know. So there are many things, even what you would be, facing in your life about the allergies, right? Sometimes the gum allergy, sometimes, there are different vegetables and there are different, elements of your diet. Maybe sometimes dry fruits are there. Some people have the different allergies in their life with the food, and they have the food intolerance. Right. So today we have the same webinar on the food allergy with the food intolerance, and to discuss with us, we have our very well known, dietitian and clinical nutritionist, Ms. Sharanya Shastry. So Ms. Sharanya Shastry is a preventive clinical nutritionist with a special interest in sports nutrition. She is a published author for newspapers like Deccan Herald, Bangalore Mirror, New Indian Express, and magazines like Femina and India Today, both online and offline versions. And she has also conducted many corporate webinars with the companies like Titan on semiconductors and Johnson Controls, Avia, Abnet, and other many more. So let me take you all through her education. She holds her double masters in sports science from IAST Pune and dietetics and applied nutrition from the renowned Manipal Academy of Higher Education, Udupi. She is also certified in bariatric nutrition and diabetic education. Her areas of interest include recovery from sports injury and importance of nutrition among athletes, especially women. She has she had hands-on experience as a nutrition intern at St. John's Medical College Hospital and as a student at Kasturba Hospital, Manipal. She is a life member of Indian Dietetics Association and actively takes part in conferences related to nutrition and public health. And you can see, I think she is taking the 28th or 21st session with us today. So I welcome Sharanya, you for this wonderful webinar, and always, getting on the toes, being on the toes for the such webinars for the public and the people's interest. So thank you very much for accepting our request and delivering such wonderful seminars with us. Thank you very much. And I welcome all the participants here. I can see there are many participants, 76 right now, 74 with us. So thank you all for joining us to this wonderful webinar. And let's start. I think let's not delay much. Over to you, Saranya.
Thank you so much for this wonderful introduction, and it's always nice to be here. So without much delay, I will just share my screen, and please do let me know when, if it's visible.
Yes. Please go ahead.
Yeah, I think that's good.
Yeah, I think you have to open it, right?
Yes, I have. Isn't it still visible?
No, I think then you have to minimize the folder maybe.
Okay, I shall do that. I shall redo it.
Sure, no worries, please try.
Is it better now?
It's visible. Yeah. Yes, it's visible. Absolutely.
Yeah. Okay. So today's topic is very different from the usual weight loss, weight gain, the gut health, and the general things that we come across. Most of the times, it's always about type 2 diabetes, thyroid, the chronic disorders that we all see. So today, food intolerance and food allergy, I thought this is very important because this is indirectly connected to your gut, to your health, to your everything. So there is food intolerance and food allergy, which are used very synonymously, but let me tell you all today that these two are very different things. Though we do not have a lot of literature, and though we do not have a lot of work being done on this particular area, But there are a lot of things that are coming up of late, and I also want to throw some light on the history of this food intolerance and food allergy, and if they are the same, and if they are not the same, then how to deal with it. So for everything, right from food to weight gain, weight loss, metabolism, staying healthy, of late we have realized that gut is very important. And even after COVID, I think we all have been taking a lot of good care about our gut health. So because we know that gut is very important, because we have the microorganisms in our gut or the intestine which are responsible for digestion, bloating, acidity, constipation, and basically good health and metabolism. And if that doesn't happen, then we know that we are, immunocompromised, or it affects our immunity as well. That is why they say that, intestinal immunity or the gut immunity is very important. And that is why even when somebody takes antibiotics, even for a simple fever or for a simple viral infection, um, we always encourage them to eat good homemade probiotic food, so that the good microflora or the microflora of the intestine or the gut is not flushed out. Because these organisms, though, are not very popular, but of late they are getting popular with so many brands and products being launched in the industry. But earlier people did not know the exact reason, but we had this practice that eat homemade curd, or drink lots of water, or eat khichdi when you're unwell. So basically it's all about having a healthy gut, because you never know that this gut is so important that it can kind of influence your mood, which I think I always talk about. That is the gut brain axis, and even the Harvard study backs it up, saying that your mood swings or your mental health is directly related to your gut health. And also we have this very famous saying in English saying, what does your gut feel, or what's your gut feeling. So gut is related to your psychological health, it is related to your physical health too, not just in terms of metabolism, weight gain, and weight loss, but it's also about the way you digest food. So there are 5 steps to eating food. So first one is ingestion. We know that we all eat food, then we have digestion, and then the next 2 steps are A and A, that's absorption and assimilation. That's very important. We all know about digestion, but so many times the absorption and assimilation does not happen properly. And why that can happen, or what's going on, or what's going wrong on a longer run, is what today I want to talk about, which is the leaky gut theory. So you see the picture here, I'm sure you have observed this. So the normal gut, you have the bloodstream, you have these intestinal perforations, these are your villi. The cells are tightly packed, they only allow whatever has to pass through. You know that the intestinal membrane is semi-permeable in nature. That's basic 8th standard, 9th standard science. And then when there is a leaky gut, what happens is the gaps are formed between these, perforations or the intestinal tissues, and that is why you have larger particles like food, proteins, bacteria, chemical toxins entering the circulation, and that is why it triggers an immune reactions. Many a times I get questions like, pehle to we would eat roti, nothing would happen, we would eat dal, nothing would happen, but off late I'm developing a gastric problem on having dal, off late I'm developing an allergy kind of a thing after having roti. Why is it happening? I have grown up eating roti and rice and dal. So yeah, this leaky gut could be the answer to these questions. It's not that you're allergic, because the term allergy is a very different thing, which I'll keep talking about in the upcoming slides. But leaky gut is one of the main reasons for any gut related issue or food intolerance in general. So physical barrier, gut or intestine, we know that it controls absorption across membrane, forming tight junctions as you see in the picture. So tight junctions break, then obviously the permeability increases. It's like as easy like the door is very important of the house. The door gets a little loose, then you know that the thief can enter, the dust can enter, anybody can enter. But why does this happen? So there are certain reasons which people have come up of late. There is a lot of research being done in this field, which is a very niche area. Not many people are talking about this, and not many people even know the root cause of this. Digestive issues, here I mean to say chronic acidity, chronic bloating, chronic constipation, or maybe even irritable bowel syndrome. So people who are neglecting your acidity or your bloating or chronic constipation, who are just taking a Gelusil or some other tablet and just kind of delaying it, so again the gut weakens there. So I'm not saying everybody with acidity will have this problem, but anything on a chronic I mean to say 5 years, 10 years of untreated health problems. Second one is even in some respiratory conditions like asthma, uh fibromyalgia. So fibromyalgia, I am not sure if people know what it is. It's a very chronic pain or the disorder with joints and bones where you always have a very nagging pain in the entire body. Mental health issues, like I said, certain mental health conditions like anxiety, depression, they also weaken the gut, because like I said, gut and your mental health is very well related. Autoimmune conditions, so autoimmune conditions, as you know, autoimmune means where the body starts attacking its own cells, like it starts considering its own cells as foreign. So in certain autoimmune conditions, again, this leaky gut happens. So leaky gut and autoimmunity is a big upcoming hot topic. So, here are a few facts. In America, leaky gut or intestinal permeability is a critical factor, which at least comes to approximately 50 million patients. So, autoimmune conditions in India maybe are not very popularly seen apart from your arthritis and things like that. But in America, it is 50 million patients, closing to a good population of people who suffer from autoimmune conditions, and they are very prone to have a leaky gut in the longer run. So why again autoimmunity develops? Three major factors. So one, it is due to autoimmune condition you can have a leaky gut, and even a leaky gut can lead to an autoimmune condition, is what I'm trying to say here. So leaky gut is also one of the factor which could trigger an autoimmune condition apart from your other triggers and genetic predisposition. So that's very important to understand. So, talking about the gut, now we understood how important our gut is, or what is the importance of these gut microorganisms in our diet. Now, let's talk about what exactly is food intolerance. So, whenever we say intolerance, so going by the traditional typical definition, difficulty in digesting certain foods due to variety of metabolic, pharmacologic, and gastrointestinal detrimental reactions to various components of food, thereby causing common symptoms such as cramps, bloating, diarrhea, acidity, body ache, and pain. So it's not that you are allergic to it. Allergy is a different thing. This is just the capacity or the incapability to digest these foods. It could be, like I said, because of various reasons, okay, like whatever are mentioned, like your metabolism or your pharmacological, maybe if you're on certain medications, and gastrointestinal reactions. So, food intolerance primarily involves only the digestive system. It has got to do with your digestive system. It means it is directly proportional to your gut health. The weaker the gut, the more chances of you having a food intolerance. Food intolerance, secondly, does not have, or you do not observe it from childhood. Okay, like Dr. Ajit was talking about, having certain allergy to certain foods. So allergies are always seen since childhood. Some people are lactose intolerant, or the child cannot take milk and milk products ever since he's a small kid. Or somebody cannot have eggs, they're allergic to eggs, they're allergic to peanuts. So that's a different thing. Intolerance develops over a period of time. That's very important for us to understand, because we often confuse intolerance with allergy. So generally, intolerance happens over a prolonged period of time. Prolonged could be 2 years, 5 years, 10 years, 15 years. There is no bracket to it. Okay. So food intolerance again can be of a functional or a structural origin. So functional causes are your enzymatic deficiencies. Okay. So lactose intolerance is also a kind of food intolerance because they lack the enzyme lactase. Very simple. Or it could also be due to pharmacologic reactions, okay, due to some toxic and non-toxic substances in food. Like suppose there is food contamination, like suppose you ate something something outside, so maybe the flour, the wheat was not of very good quality, so you developed some, kind of a gas or a bloating after you ate some chole bhature outside. Or it could also be due to non toxins, so that is your, be due to other like biogenic amines, salicylates, your sulfites, especially in wine and medications, or whatever are mentioned here, your preservatives, all these things. Or it could also be due to viral, bacterial, or fungal infections that can lead to dysbiosis. So dysbiosis is your, we all know what is dysbiosis, a shift of the gut microflora, which is from, where there is an imbalance that is created in the gut, okay, thereby resulting in, any kind of food intolerance. So these are the functional causes, and the structural causes could be, again, it is to do with your anatomical changes. So somebody who has had a gallbladder issue, okay, somebody's gallbladder is not functioning up to the mark, they have had a gallbladder removal or something like that, any stomach where there is a resection or any stricture in the esophagus, chronic pancreatitis, the any anatomical change in the body, okay, can also lead to a food intolerance. Because as we know, whenever your digestive system, the main organs of the digestive system are not really up to their mark, when it comes in terms of their functioning capacity, obviously there is a change in the absorption, there is a change in the assimilation of food, and that is why you may turn intolerant to certain foods. Like for example, people who have had a gallbladder removal, for example, are not very good when it comes to tolerating dairy products, okay, because the fat absorption is affected, right? So it's not a generalized rule. There are many people, but certain people observe such changes that earlier they could drink more milk, and probably now they are not really tolerant towards dairy. So these are the functional and the structural causes for the food intolerance. So food intolerance, I think, is now clear, and what exactly an intolerance means. So now let's talk about food allergy. So allergy is what we commonly talk about. Allergy, when we say we ate something and there is itching, there is edema, there is swelling of the tongue, there are hives, there are rashes, vomiting. Then there could be, it could be from mild to severe. So allergy can be like, especially with food again, common allergens like I've mentioned here are seafood, wheat, nuts, eggs, cow's milk, peanuts. Peanut allergy is the most common in the Western world. Seafood, again, a lot of people have severe allergy towards prawns, crabs. So allergy is an abnormal immune response to food, right? So intolerance is a very different thing, and this is, allergy is to do only with your immune system. So intolerance is about your digestive system, and for whatsoever reasons that I have mentioned, it could be functional or structural, and that is due to the reason why it results in intolerance. But allergy has to do, or has got something to do with our immune system, okay. And allergies, like I mentioned, are again seen since childhood, okay. Like we are allergic, anything, if it's not suiting a particular kid or a person, is always seen since childhood. Nobody can develop an allergy at the age of 45 or 50. If they are developing certain resistance or vulnerability towards foods at that age, then it means they are intolerant. So that's the difference, right, when we are talking from a very scientific point of view. So mode of action, proteins usually act as allergens, and because these are all basically mainly made up of proteins, when you look at their structures, they are mainly made up of amino acids. So they are the allergens, and that is why they are recognized by the immune system as harmful. There is no reason as why the immune system recognizes it as harmful, and that is why there is a trigger, of the inflammatory chemicals like your cytokines, histamines, all of these things, and that leads to widespread reactions. Like I said, it could be extremely mild to it can be extremely severe. I'm sure you all know what is anaphylaxis, which can be extremely life threatening too. Okay, so three groups, I'm sure you all know. IgE mediated, so whenever there is the allergy, you know that there are immunoglobulins released. So immunoglobulins are again, of five types. So IgE is very commonly produced in an allergic condition. So IgE mediated, non-IgE mediated, and a hybrid. A hybrid is where you have both IgE and non-IgE produced. So food allergy is totally it only consists of your, it has, or maybe I can say that it only comprises of your immune system and the reaction of your immune system depending on the trigger, whether it's an IgE mediated response or whether it's a non-IgE mediated response. And I hope I'm clear till here. So different types of, now I want to talk about food intolerance. So when I talk about intolerance, that is what, when we all say that off late this thing is not suiting me, or off late I have given up on gluten, or off late I'm not consuming a lot of dairy. So that is what we are talking about today, which is food intolerance. So there are 4 to 5 uh, classes of intolerance which of late has got categorized into. Gluten intolerance is the most popular, we all know about it because there are a lot of gluten free briskets, gluten free products that are in the market and which are usually gaining popularity through social media. There are also dal intolerance, nuts and seeds intolerance, milk and dairy intolerance, and you have intolerance towards non-vegetarian and processed foods. Okay. So coming to the first one, gluten intolerance. So only after 2010, okay, numerous papers have been published and people are now familiar with gluten intolerance very vaguely. But still, this gluten intolerance is often confused and it is used very synonymously with allergy. It's also commonly confused with celiac disease, with Crohn's disease. So it's very overlapping when it comes to gluten intolerance. Gluten was a very foreign term to the fraternity of nutrition also. But only after 2010, like I have mentioned here, papers have been published. But the first case of gluten intolerance was mentioned or reported in 1980s. So it's not new. It has been there, but maybe we did not know the differences. We did not know how to word it, or probably we did not know how to approach these intolerances with food, because it's very overlappingly used, right? So gluten is nothing but a mixture of prolamins and they're present in, like, all wheat and wheat based products. To clear the confusion, let me tell you, gluten intolerance is an umbrella term which integrates 3 major types of gluten related disorders. So we all confuse, and we are always confusing it with celiac and Crohn's. But let me tell you that there are 3 things, 3 subdivisions to it. The first one is autoimmune celiac disease. The second one is allergy to wheat, and the third one is non-celiac gluten sensitivity, which is called NCGS. Okay. So autoimmune celiac disease is the most common one, which we all talk about. Most oftenly, we are confused with that. So it's nothing but an autoimmune enteropathy, which is caused by, again, genetic or environmental factors. And it has a very less prevalence in the entire world. It's only about 1% of the population. Okay. And here in such people, it is, the celiac, it is some, obviously the name itself states. So it has something to do with the celiac lining or the intestine. So basically, after the food or whatever, any food that contains gluten enters the digestive system, they are partially broken down by the enzymes which are present in the GI. And there is a peptide called zonulin, which increases the permeability of the gut, and that is why it is overexpressed. Okay. So this is the mode of action or the detail about the autoimmune celiac disease. And that is why when these peptides are there in the intestine, since they are overexpressed, they are making it more toxic and immunogenic. And that is why in celiac disease, you have gluten restriction. Okay. Next comes the simple allergy to wheat. So certain people, so not everybody who is allergic to wheat has a celiac disease. Okay. So you understand that there are 2 different categories, and not everybody who is allergic to wheat is again gluten intolerant. It's totally different. So allergy to wheat is nothing but, you just have a lot of immunoglobulins, that is IgE, which is secreted. And it's nothing but like how people are sensitive to peanuts or eggs. There are people who are sensitive to wheat, maybe because they cannot handle the mixture of prolamins that are present. So in such a condition, the best thing is to avoid wheat. Okay. But the third category is where most of us fall into, which is called the non-celiac gluten sensitivity, which is called NCGS. So this is where we all get confused. We never know, or we are not even aware of the fact that there is MCGS. We always try to put ourselves in the first two categories, either in the celiac category or in the allergy category. The third category is where we fall into, like most of the people who are not able to tolerate gluten, that is wheat and wheat based products. And this is mainly due to your gut issues, like if you have had a very chronic bloating, acidity, or a very bad gut health, or if you have had nutritional deficiencies. Okay, it could be simple B12 deficiency, calcium deficiency, vitamin D deficiency, or if you have any autoimmune condition. Okay, like probably you have a Hashimoto's thyroiditis, or you have an arthritis. So most of the people who complain of gluten intolerance are actually into the third category, because the first one that I mentioned is a very small prevalence of just 1%, and second one, allergy to wheat, at least in India, is not very popular. Like I said, allergies are always seen since childhood, and the third one is where we kind of miss out on. So what are the alternatives to this gluten? The answer is millets. And I'm sure 2023 Karnataka was, it was the highest producer of millets. So, and we had the millet based theme where it was everywhere, celebrating millets. So wherever you feel, if you feel that you fall into the third category, you're not able to tolerate wheat and wheat products well, then you can switch to millets. Depending on the region that you are in, depending on the cuisine that you follow, you have so many millets. For example, you have foxtail, you have ragi, you have jowar, you have sorghum, you have barnyard, you have little millet. The list is endless. So this is about gluten intolerance in short. Moving on is dal intolerance. So this is something which is very, very new. Again, new as in new in the Indian scenario, because people are, and they take a lot of time to accept also that there are intolerant towards dal, because Indian recipes or Indian cooking has dal in everything. Dal, I mean pulses. Pulses includes both dal and lentils. So we cannot imagine cooking without tur dal or moong dal or horse gram or any other dal. So detection, acceptance, and compliance with a dal or a lentil free diet is very, very challenging, because in the first place people do not even diagnose it, or they're not even understanding that this could be the reason. And it is a myth that here I want to mention that high protein foods are required for one to stay strong and muscular. So here, let me make it very clear that I'm talking about a normal population, sedentary population, who are, probably just living their normal lifestyle. I'm not talking about any special condition like a pregnancy or an athlete or someone who is, in the adolescent age group. Okay. So many people think we need a lot of protein, but it's not true, because then I want to bring into your notice about the theory of autophagy. So theory of autophagy is something which was suggested by a Japanese scientist, and I'm sure he won the Nobel Prize also for this. So it says that the formation of autophagosomes comes into play during starvation and not when excess proteins are consumed. So excess, I mean here, according to Indian standards, we take around 0.8 gram to 1 gram per kg body weight. So ideally, it's 1 gram per kg body weight of protein that one person requires on a day-to-day basis. So for example, if you are a 70 kg person, you need 70 grams of proteins per day. So if you try to overdo proteins, which most of the social media and social media influencers try to project, okay, again, the disclaimer is I'm not talking about a person who has a need of protein. I'm just talking about a sedentary population. So for that person, the autophagosome formation does not happen. And that is why when the autophagosome formation does not happen, they do develop some changes in their immune system. And at an oxidative level, there is some kind of stress that is created. Okay. So the theory of intermittent fasting, which is on a rise now, which is very popular, is because they kind of want the body to produce autophagosomes. But again, again, that doesn't mean that you starve completely from eating, but the phagosome development or the formation happens when there is minimal or the bare minimal protein that is present in the body. Okay, so that is why people have started intermittent fasting, which is again a fad, but based on this principle of autophagy. Okay, high protein diets also are known to lower manganese levels, resulting in spasms, convulsions, neurotransmitter issues, Parkinson's, and low Gehrig's disease. This is according to a research paper. So yes, there are many papers that have of late come which talk about the protein requirement for a normal sedentary population. But first of all, detecting this intolerance, it itself is a big thing, because people do not really understand this. And dal, like I said, is a very integral part of the Indian diet. So even thinking about these things on these lines is again very difficult. So, dal based intolerance is again also due to adulteration also. So, especially in cities, metro cities, the quality of food that we get, or the things, how much ever we say it's organic, we all know that it's not really organic. So there is adulteration. So that is also one of the reasons why sometimes people develop some kind of gas or bloating, or gut issues, or they have a frequent urgent urge to excrete after having dal based foods. So what are the alternatives? A few alternatives here. So try to have fruit based curries, like your pineapple curry, or any other like gourd curry. Okay, vegetable based subsies, and try to make, if you observe these things, try to include sambar or rasams without dal, or probably decrease the proportion of dal. So a few examples here are mixed bell pepper palya or sabzi, where you don't require dal, you don't, and then you have methi palak sabzi, you have avial, or you have like grilled vegetables, which again do not need dals. Okay, so the third one is nuts and seeds. So again, nuts can be classified into two categories called tree nuts and fruit nuts. And the nine most common tree nuts are your walnut, almond, pista, cashew, pecans, hazelnut, macadamia, brazil nuts, and pine nuts. So these tree nuts are the most common allergens. So here it's very important that you understand whether it's an allergy or an intolerance. Like I have said, allergy is something that you've noticed since childhood. So like most common is your peanut, right? Or your groundnut. So groundnut allergy can be there since childhood. So if you're noticing things like a walnut is inducing some kind of a blister on your face, or it's causing some kind of a digestive issue, then it's not an allergy, it could be an intolerance, because these are all they fall under the category of tree nuts. And the most common seed allergy is also observed. So when I talk about seeds, you have pumpkin seed, flax seed, sunflower seed. So sesame seed is the most common seed allergy that can cause, that is known to be seen in the population. But again, it's not an intolerance, it's an allergy. So those who are allergic to flax seeds, okay, could also be sensitive to mustard seeds, poppy seeds, sunflower seeds, nutmeg, wheat germs, chia seeds, everything. Right. So again, I hope you don't get confused. I have just put both intolerance and allergy in the same slide. So intolerance is something that can be seen at any point in life, and allergy is something which you observe since childhood. So what is the alternative to these? Suppose like you're not able to handle an almond very well, or you're not able to handle a cashew very well. There is always coconut. So coconut based products and coconut itself, like coconut, even in coconut milk, or coconut, the dry coconut, or the normal the wet coconut can be used. So coconut is, though it has nut in it, but it's not actually a nut. I mean, it does not come under the tree nut. Okay, and lotus seeds, makhana, which is again very popular, so is also very good. It is not known to cause any intolerance, or or any allergy. So people who face an intolerance, or if you have observed here that these things which are mentioned here are not suiting you, these are the alternatives. Dairy intolerance, I think this is very commonly known. Lactose intolerance is what um, we all talk about, which we have studied and which we come across very often. So dairy, I think we all know milk products. I don't have to mention. Dairy means it has milk, paneer, cream, malai, all of this. So commercial bovine milk comes from pregnant cows containing natural bovine hormones that diffuse into the milk, such as prolactin, insulin growth factor 1, and other steroid hormones. So this is just a fact that I picked up from one of the research paper. So this is one of the reasons. So I have people who come and tell me that um, I have all, grown up drinking milk and eating paneer, but of late people are telling me not to eat milk or eat paneer or drink milk. So it has nothing to do with, somebody stopping you from consuming these things. But it is true that these synthetic proteins or hormones or steroids that are being used in the production of milk are known to be carcinogenic also, and they are also known to cause many other hormonal imbalances among females. Because we also understand that these hormones are not really destroyed, or these synthetic proteins are not really destroyed even on pasteurization. So it doesn't mean that you all have to remove milk from your diet, but it's very important that you know the source of it and know the authenticity of it. Okay. So is lactose and dairy intolerance the same? So it's not the same. Okay. Lactose intolerance is again, crystal clear. It's because the person does not have the enzyme lactase being produced, and that is why he is not able to take in the lactose containing food products, is lactose intolerance. When I talk about dairy intolerance, I'm talking about the protein here, which is beta casein A1. So lactose is basically nothing but a sugar, right? Like it's nothing but lactose, which needs the presence of an enzyme lactase. So basically lactose is nothing but a saccharide. So but when I'm talking about dairy intolerance, I'm specifically talking about the protein, which is beta casein A1. So there are people who over period of time, again due to various reasons, medical reasons, immunological reasons, or probably due to pharmacological reasons, or due to gut health issues, develop an intolerance towards this beta casein A1, and that is why they are not able to handle paneer very well, or they're not able to consume dairy products, or they're not able to digest these dairy products very well. So alternatives for these are nothing but plant-based milk sources. So rice milk, goat milk, almond milk, coconut milk, all these plant-based sources are extremely recommended for people who are observing issues with the consumption of dairy products in today's generation. So food is the most essential thing that a human being can think of, but at times this food can become poison, and it can lead to intolerance due to irregular eating habits and due to faulty diets. So this is one of the proven I can say results of one of the research papers. So this is why our diet or our nutritional plan is very, very important. And in the era of wellness and nutrition, where everybody, we all talk about weight loss, we are always talking about what to do, for our hair, skin, and when it's on a very superficial level, diet and calories are always used synonymously. We are only counting calories, we are only thinking of the portion sizes. We tend to miss out on certain nutritional importance and certain concepts of food intolerances, like I was talking about today. And that is why the more important thing that we all have to follow is follow an antioxidant rich diet. So it is not just for somebody who has a food intolerance, or for somebody who is allergic to something, or it is not for someone who just wants to look good. It's for everything. It's like one answer for all the problems. So any diet, okay, first of all, I don't like to call it as a diet, but any nutritional plan which has more of antioxidants. So antioxidants are nothing but having more fruits, your vegetables, again, more as in, I don't want you to cut down on one food group and start eating only fruits for a meal or only vegetables for a meal. It has to be balanced, and like I always say, it has to be in its own proportion, and it has to be balanced. There has to be no nutritionism, there has to be no just imbalance of one food group dominating the diet, but including antioxidant rich foods like nuts, seeds, berries as in the locally available fruits and vegetables, all these in proportion at a very cellular level decreases the oxidative stress, and that is when it gives you a good immune system and you have a good gut health. And then you do not have to be really dependent on a laxative, you do not have to be really dependent on a pill for solving your acidity or bloating, and then you also do not need supplements, and it can be very economical for you. So health is the result of obviously investing in good nutrition. So nutrition not just to weigh a particular number on the weighing scale, or nutrition not just to look good and look younger, but nutrition which keeps you metabolically healthy. So because ultimately whatever you are on the weighing scale, we don't really care. Biochemically, how good are you? Metabolically, how active are you? How good is your system is what matters. So thank you very much. You can always reach out to me. This is my email ID. That's my LinkedIn contact. And I, along with Dr. Nanda Rajneesh, who is a surgeon, have actually written a book on this exclusively for vegetarians who are suffering from food intolerances. So it's available on Amazon and everywhere. So you can read in detail about what exactly is this and how it is. I mean, the same thing, but maybe much more in depth. So thank you. Thank you very much. And I think I'm open to take questions.
Thank you very much, Ms. Sharanya. Thank you for this wonderful webinar. And I was talking about the mushroom allergy. Can you just put some glance on the mushroom allergy? Or it is a mushroom intolerance? What do you say? People
Yeah.
usually they come up with that.
Yeah, again, mushrooms are again nothing but, they are again these proteins. Again, they have a lot of amino acids. So whenever you talk about these mushrooms and all, so it's not a very common allergen, at least for some. It's not like a peanut or an egg allergy. But
Yeah.
if you're observing that since childhood, then it is an allergy. But if you have developed that over the years, then probably you're intolerant to that kind of mushroom that is being used. So there are
Okay.
again different varieties of mushrooms. So it may be sometimes, the mushrooms that are grown in India is not suiting you, or in that particular state is not suiting you.
Okay.
So again, so that is very subjective, and you probably have to try different varieties of mushrooms and then see what exactly is
Okay.
happening. So the symptoms, like I mentioned, if it's just, body ache and diarrhea and pain and all that, then it's an intolerance. But, if it's very severe, like allergy based symptoms, like you're developing rashes, there is vomiting, then it is an allergy.
Okay. Thank you. I think you're getting a question. Can you explain the anaphylaxis related to food allergy?
Yeah, so anaphylaxis is, you all know that whenever there is anaphylaxis is nothing but a lung, a shock basically. So which is very detrimental. So like how you see that with medicines, like if somebody who's allergic to penicillin is administered penicillin, within a few seconds there is a shock, like the lungs do not breathe. I mean, you're not capable of breathing and you die then and there. So similarly with food allergy also, if you're extremely allergic, the most common allergens being peanut, which I was talking about in the West, and eggs in India probably, if
Yes.
they have ingested that in a very large quantity, so within a few seconds it can give them a septic shock and the person can die on the spot. So that is anaphylaxis with respect to food allergy.
May I ask my question? Yeah, why not? Please open your mic and speak, Krishna.
Good
Yes.
afternoon.
Good afternoon.
Ma'am, I want to ask about the probiotics and relation with the food intolerance. Like probiotics is nowadays, we are observing many companies and probiotic supplements are coming nowadays. So is it related to the food, like it can benefit in food intolerance, or there is no relation between them?
Probiotics are like general good, they're like the good things which generally do good things to everyone. So even if you have a food intolerance, or even if you do not have a food intolerance, you can still take them. They're only going to increase the good organisms in your gut. But there are certain probiotics which are exclusively meant for food intolerances also, which are there in the market today. So in general, you want to consume a probiotic, no harm. Anybody can consume a probiotic, and that is what most of the companies out there are trying to do. But there are specific probiotics that are mentioned, like specific strains of bacteria induced probiotic for specific food intolerances also. So probiotics are definitely connected to, intolerance and all that, but not necessary that anybody who's consuming a probiotic should have an intolerance. It's just like consuming a multivitamin supplement. Everybody can take it. There's no harm in that.
Saranya, I think we have many questions now.
Right. I think I shall read it myself. So, uh,
First question goes with Pravina Ganesh.
okay, yeah, the food allergy happens naturally as normal immune mechanism. If we take any medications for it, suppress our immune system. Is it safe to leave as such or take? No, no. See, when you're having a food allergy, the first thing is you avoid that food. I mean, there has to be an elimination protocol that has to be followed, and you first eliminate that food. But in case you have consumed that food, that particular food, then it's very important that you take the medication, because you never know if that allergy is very mild or severe to you. So it can be a very severe allergy also, right? So you cannot just think that it is calling for an immune reaction and it's not good for your body. You have to take the medication if you have consumed that allergy containing food.
Okay, ma'am.
I think he has another question.
I can't see that.
No, it's before all the questions, I believe.
Right.
How sudden wala question? Check.
How sudden? How to identify? Is it, can food allergy trigger? Can food allergy trigger pimples?
Yeah, before
Food.
that, before
Okay.
that.
Food allergy does not, yeah, okay, I found it. Food allergy does not trigger pimple. Food intolerance can trigger a pimple. Allergy will immediately give you rashes, vomiting, and you will have a very tough time dealing with an allergy. So how sudden do we face food allergy? Food allergy is very instant. So depending on how severe, it can be from within 10 to 15 minutes, or probably if you're very severely allergic, within 2-3 minutes of consuming it. Like if you're allergic to prawns and all that, I know someone who just eating prawns, within 1-2 minutes, he develops all kind of nausea, and that person really needs attention. So
Yeah.
it is very immediate. It's not like it takes 2 hours. How to identify that we are allergic to this type of food? Yeah, the symptoms that I mentioned. So allergy is always rashes, vomiting, hives, all these immediate. It's basically an immediate response whenever you have something. And there are numerous categories to take food allergy tests. So mostly I again lost it.
They will cover these seafoods, dairy products, peanuts, etc.
Huh.
How to identify what food has caused the allergy.
Oh, yeah. So, what food has caused the allergy? Again, are you talking about intolerance or allergy? Since you're mentioning allergy, you can get the blood test done, and the blood test is usually indicative of what you have eaten in the past 2 to 3 days. That is what is seen in the blood test. So, allergy is very different. You may not be allergic to any of it. You may not even be allergic to the seafood. You may not even be allergic to the peanuts. But if you're intolerant, is the question. So
Yeah.
intolerance is again due to your gut health and, like I said, all these factors. So allergy, yes, the blood test serves the purpose of allergy, but intolerance cannot be seen through a blood test. That is probably the drawback of the system. Yet I think there is many more studies that are happening here. So intolerance, right now we do not have any parameter, biochemical parameter to check for intolerance, because it's not on an immune level at all. It's on a digestive level. So probably we need to come up with some markers or something.
Yeah, I think it covers her fourth question also. No worries. What is the sign seen in the gluten intolerance patient? What kind of sign?
Intolerance, again, gluten intolerance, within 2 to 3 hours, that's the time gap, you start observing bloating, you start observing a lot of you have this urge to use the washroom. Probably you don't feel like excreting, but you just feel like using the washroom immediately after eating a gluten based product. You just feel like probably excreting. You also have some abdominal distension. You don't feel very good after eating a gluten based product. Probably you feel very heavy, like maybe you've eaten very less in proportion, but still you feel very heavy. So these are all gluten intolerances that are seen, and very rarely you have any rashes and all. Usually rashes and all are not seen. It's only to do with your digestive issues like gas, bloating, frequent urge to use the washroom, and feeling very heavy on the abdomen. That's the abdominal distension, all these things.
Okay. After there are questions, Sharanya, आप देख सकते क्यों? Dr. Jaya
Good
Guru has
evening,
one
madam.
question.
Excuse me, sir.
Good
I'm
evening,
having a
madam.
question.
Yes, Ravani. Yes, please ask your question.
Good
Uh,
evening, sir and madam.
good, e-
Good evening.
One by one,
Sir,
please. Ravani, first
ma'am.
you ask your question. Yeah, Ravani, go ahead.
sir.
Yes,
Good
madam.
evening, sir
Madam,
and
my
madam.
question is, what is the emergency treatment for severe allergic reactions?
So emergency treatment, you really have to, rush to the hospital because nobody who is not medically equipped cannot treat such reactions. You have to rush to the hospital and or the primary care, healthcare center. There is nothing that can be done at home if it's a very severe allergic reaction.
Madam, the
Yes.
reaction is related to the anaphylaxis. So, what is the first line treatment like we will be administering to the patient?
No, that is again the whole thing is decided by the doctor. Like how severe is it, or how what is the response? Is it very mild or is it very severe? Because anaphylaxis happens in seconds. Like you
Yes.
probably cannot even think of it. Like like when you administer penicillin for someone, if that person is allergic, it happens in seconds without giving a test dose. If you do that, so if similarly in food, it may not be that sudden, but it again depends on how severely that person is allergic. So
And
all
we,
that has to be
yes.
done in a medical setup. You cannot probably do it at home.
And we also don't know what type of organs will be involved in that, whether lungs, your heart, your brain, your limbs, what kind of things will be involved in your allergy, after the allergy, how serious it would be. So we should not take it light, and we should not give it. Usually we give antihistamines injections and all in the hospital also, but we should not try to treat it at home if it is anaphylactic
Yes, sir.
reaction due to the food. Okay.
Excuse me, sir.
Yes,
Thank you,
please.
madam and sir.
Thank you.
It's myself, Shravani.
Yes, please.
Hi.
Hi, ma'am. Good evening. I have been suffering with food allergy last 1 year.
Okay.
Doctor said that you have some acute urticaria.
Okay.
You just skip some protein food, dry foods, like that. Uh, I use it to skip, but most of the protein food, usually what he didn't said, that also cause some rashes if I take. So can you just give me what type of test I need to go for? Since last year I have been suffering.
So you need to first get a food allergy test done, like a basic food allergy test, like which has all these things like peanuts, eggs,
Uh,
dals, foods, like
mm,
your all the detailed food allergy test done, which is a blood test
uh,
done, and then depending on what is the kind of allergy that you're vulnerable to, like if you're more allergic
mm,
to a millet or more allergic to
uh,
a pulse, that can help you evaluate your diet better.
And
Mostly
allergy
protein
tests come
related
in a
diet.
package. Allergy tests
Okay.
come in a package. So you don't
Yes.
have to run around. So you just can tell that, okay, I want to do all the food allergy tests. So it come in a package. Everything
Okay.
come in a package.
It is going to cure in few months, or it is going to extend few years
See, these
by
allergy
keeping.
again, when you see the report, then you understand how severe or how mild it is. And it
Uh,
also depends on your existing medical history and again your
ex-
age and a lot of factors. So,
yes, yes,
yes, you can do a very preventive therapy for that, but everything depends on, it's totally customized. It totally depends on you, I mean, your health, as in.
yes.
So, how the severity. So, you cannot
Uh,
say that, it cannot.
Previously,
Yes.
excuse me, previously, in last few months ago, rashes will come, and within 20 minutes it will be it is not going to be observed. But after now, currently last 1 week onwards, the rashes is going to exist 1 day, 2 days, like that. So I just fear about this, and ask doctor. You just use same antihistamines like that and skip all the gluten protein related food, like that. Doctor said.
Yeah, I think with along with the medication, you need to have an antioxidant rich diet, which I was talking about, because medications, yes, and along with that, your your diet needs to be evaluated. So there are, like I said, there are so many things that can trigger this. So it may not just be gluten and protein. It can again be one simple dal or a nut or a seed. So only after a detailed evaluation, it can be discussed in detail.
Yeah, proper diet chart can be made. Yes, absolutely.
Okay, thank you,
And
ma'am.
I think it looks like a very serious problem, severe
Yes.
problem. So you must
Get a food allergy test done.
full
Here.
test. Yeah, that will help definitely.
Okay, okay, sir. Thank you, sir.
Thank you.
So, who needs to follow gluten-free diet? There is no guideline for any, only if you fall under that third category of NCGS, which I was talking about. Only for those people and for people who are allergic to wheat and for people, the three categories basically, autoimmune, celiac disease, only those people need to follow a gluten-free diet.
Okay.
Yes.
So, I think I don't know, did I lose out on something? Who needs to follow is done. The case of my relative started to eat a normal meal only after teenage. Until then he had no okay, he was not exploring foods, but he's a sportsman. Does the allergy cause due to his late exposure to more types of food? As in, what are you trying to ask? He's into sports, and he started eating proper meals only after he became an adult. So I didn't understand the question.
Maybe the exploration to the food after being adult, maybe the different places, different types of continental food, and food from different places. Maybe she's talking about, like,
Okay.
because
Uh,
normally, yeah, because a person normally, when they are in house, when they are in home till graduation or before graduation, or maybe till 10th class, then they're not much
they're eating
exposed
homemade
outside.
food. Yeah. Exposure to different foods will not cause an allergy, because if he had to have an allergy, it would have been, since childhood. But
Absolutely.
maybe he can have an intolerance, or he can have a gut impairment if he's eating very,
Yes.
outside, and it can spoil his gut health initially. Maybe
Yes.
in the longer run, if he's not looking after himself very well, if his gut is not very good, then he can have problems like some one or the other food intolerance. But allergy will not, like I said, come up suddenly at any age. That will be seen ever since childhood, if there is any.
Yeah, there are some more questions. If we can see, that is from Kushuma Kumari. One question is there.
Yeah, I had allergy. Doctor are saying due to internal heat it was developing. So they are saying my trigger is heat. How can you reduce? So I don't know, like, what heat are you talking about? Because internal heat is, are you talking in terms of, a boil, or in terms of, ulcer or anything? But if it is food related, then you again have to get your diet evaluated depending on, your consumption of non-veg, or if you're eating a lot of heat producing foods, could be even an imbalanced proportion of protein and lot of fat. So but internal heat is very subjective, like it's
Vague,
the
vague.
colloquial
It's
language.
a
Yeah.
vague idea. Yeah.
Yeah, so what is that heat? I don't know what you're talking about, but your diet, if it is very rich in oily foods, processed foods, non-vegetarian, lot of protein, like the animal protein, very less of vegetables, can cause some, I'm assuming heat means ulcer or anything, but yeah. So if there is an allergy, I don't know. Allergy in what? Again, heat allergy, I am not able to understand the heat allergy.
There is no heat allergy actually.
Yeah, internal heat, maybe I am assuming that she's talking about an ulcer or a boil.
Ulcer, or yeah, maybe hormonal imbalance. Sometimes it does that, but yeah, maybe. Okay, Dr. Jaya has some question. If you can see, Cetate mushroom is very trending these days. So, how much nutritious are these for vegetarians who is vegan as well?
Okay, who is vegan? Yeah, mushrooms are good, but again, the way it is cultivated, where it is grown. So I always say that any food that takes time to reach you loses its nutritional value. So if you are in the place where that that mushroom is grown locally or it is cultivated well, then you can have it. And mushrooms are also good sources of vitamin B12, which for a vegetarian and for a vegan is very important. But mushrooms are very tricky also, because because not everybody is capable, or maybe not, it doesn't suit everybody. Mushrooms, soya, these are things which does not suit everybody. So it can give you some kind of a bloating, or probably, if you are not very used to having it, you may not even like the taste of it. So it is in trend, yes, but again, like I said, the place where it is grown, and if it really suits your body, you have to try it in very small quantities, and then probably you can include it in cooking. But if you want me to give my opinion on mushrooms, they are really good for B12 and calcium and all, if you're a vegetarian and vegan.
Adding another question to this, what is the best food supplement for fourth grade acne?
Fourth grade acne food supplement, rather I would say cut down on dairy products, because
Yes.
acne is very very triggered by your dairy products. So like your milk, cream, paneer, milk based chocolates, milk based sweets. So please cut down on dairy, and then you please get your vitamin D, B12 levels checked, and you need to get it evaluated from a dermat. And you need to switch to a plant based diet where it is more rich in multivitamins, and you need to hydrate yourself very well. So I think for acne, rather switching to a supplement, you first evaluate your diet, cut down on dairy, and substitute yourself with other forms, like include millets, include vegetables, good amount of fiber, and get your vitamins and your hormone levels checked also, if you have any existing hormonal imbalances in the body. So
True. Okay. One of my family members gets sneezing when he eats, or even some cooking fragrance of peanuts. Is it like okay, or just by not eating it up to keep him healthy?
see, sneezing is, it can trigger, like even when you have a tadka, you can it triggers
Yeah,
that
absolutely.
olfactory response, but it's not an allergy. It could be some, some people have this thing with pollen, dust, and all that. So as long as when he's eating, he's fine and he's not developing any problem, I think the sneezing is okay. Maybe it could be the tadka or whatever. But yeah, if it's constant, like if he's sneezing continuously, then probably he is allergic to some other component. But peanut, I don't think so it will cause that much of sneezing. But after
Yes,
ingesting, if you see a lot of sneezes, then yes, probably he is allergic or he's not tolerating it well.
absolutely. Do more consuming dal could affect the body in what way? Affect the body, Pooja, please mention perfect, I mean clearly how. Okay, I mean daily consuming dal could affect the body.
No, daily consumption of dal will not affect your body, because bioavailability of lentils or pulses as it is very low. Because especially in an Indian scenario, when you're cooking for 5 6 people, or probably you're cooking only for yourself. So the amount that you're using is very less. And again, when you're serving, everybody takes a different portion of the dals. So as it is, the protein coming from dals, like let's say tur dal or any dal, is very less. You're not taking 4 5 ladles. It's only one ladle of dal or 1.5 ladle of dal.
Yes.
But if you consume it on a very frequent basis, or in a very irregular basis, where you eat more of dal, very little of rice, or no roti, then yes, it can cause water retention, which is the natural property of dal, and it can give you bloating, which is very commonly seen in rajma, chole, and things like that. So, but it's not going to kill you or be detrimental to you. It will only make you feel very heavy, make you feel very gassy, bloated, very uncomfortable. That is because of the proportion in which you're eating, like an abnormal consumption. Like if you're eating normal dal, roti, chawal, it's okay. But there are some people who eat only dal and no roti and no chawal. Then in that case, and that too, if it is not homemade, the method of preparation is again very important. So then it can cause some bloating. Otherwise, normal one ladle of dal will not cause any harm.
There is no feedback link, guys. There is no feedback link. How to treat any allergic condition after getting allergy from any food? Usually antihistamines, but better if it is a severe, moderate, then go to the doctor. Madam, then what we do for calcium if we cut on dairy products?
Calcium, best sources of calcium are green leafy vegetables. Okay, so now winter, so you have so many green leafy batua, you have so much of saag, all of that. So green leafy vegetables, your seeds. Okay, so if you're not allergic to any seeds, sesame seeds, your chia seeds, pumpkin seeds, all the seeds that are used in cooking. And apart from that, you also have certain fruits that are rich in calcium. So you can include all of these if you cut down on dairy. And there are obviously calcium fortified cereals. So certain millets like barnyard millet is also very rich in calcium. So you can include all of these millets. Then you can include nuts and seeds and green leafy vegetables.
Yes, absolutely. Madam, how is lectin intolerance occur and what happens when lectin is not processed properly in the digestive system? What are the internal complications?
Lactose intolerance.
Looks like that, yes, lactose intolerance.
Yeah, so lactose intolerance is because there is no enzyme lactase to break down the sugar, which is lactose. So when lactase is not present, then obviously lactose is not broken down. So there is a very abnormal, breakdown of lactose, which again creates more digestive issues. So they have vomiting, bloating, and so that these are what happened.
Prasad, I think, is eating paneer today.
Yeah. So these are all the problems that happen on an internal level. So basically, there is
Okay.
abnormal accumulation of lactose.
Sonia is asking, is it good to consume chia seeds by diabetic patients?
Yes, it is. It is good. Chia seeds are good.
Okay. Someone is asking the diet. Consultation here. Ma'am, my relative is a vegan. She has symptoms of leg pain and back pain frequently. Could you please suggest some diet supplements?
I think that you have to consult me in person only because you need
Yes.
a lot of history for that.
Yeah,
Yeah.
it takes a lot of time. Yes. Thank you very much, guys. Thank you.
So thank you.
Ma'am, thank you very much. So Pooja is asking, ma'am, not even badam milk भी नहीं पीना है क्या अब?
No, badam milk, again, that's a plant-based milk. You can have that, but again, if you're intolerant,
I
then
think she is
again,
asking,
lactose. Huh.
she is asking mixed badam in the milk.
Oh, no,
That,
no, no,
that
no.
wala badam milk.
If you're, no, badam in milk, not allowed if you're dairy, I mean, intolerant towards dairy or if you have acne, but you can have plant-based milk sources, like I mentioned, rice milk, oat milk,
Yes.
all of that.
Yes. Okay. So guys, thank
Thank
you
you.
very much. Rest of the questions we can take in the next class. And thank you very much everyone for joining in the
Thank you, sir. Thank you, sir.
webinar, attending the wonderful webinar. And a lot of interactive session to us because we had around 30 minutes of interactions. There is no feedback. Certificates for the registered participants will be given by tomorrow morning. Okay, guys. Thank you. Thank you very much.
Thank
Thank you,
you.
Saranya. Thank you very
Thank
much
you so
for
Thank
much.
you,
this
sir and
wonderful
madam.
webinar.
Thank you so
Thank you,
much.
everyone. Take care. Good night. Have a good night, guys. Take care. Bye bye.